Parenthood, one of life's great challenges and rewards.
But it's a life experience out of reach for many. According to the World Health Organization, 1 in 6 people struggle with infertility. Infertility is the failure to achieve a pregnancy after 12 months or more of regular unprotected intercourse. It affects millions of people and can have devastating emotional, physical, and financial impacts. The WHO says treatments for infertility can include medication, surgery, or assisted conception. But many people lack access to these treatments due to high costs, social stigma, and limited availability.
The organization says its report points to a, quote, urgent need to increase access to affordable, high-quality fertility care for those in need. Starting a family can be an exciting time. But for people like Kristen and Rico Pleasant, it can also be a time filled with emotional and financial strain.
We put off our medical treatment for infertility primarily because of cost initially.
The couple from Monroe, Louisiana was diagnosed with infertility in 2017, and their health insurance doesn't cover treatment.
In us putting our treatment off, I developed uterine fibroids. And I had to have major surgery to correct that.
Kristen has since had multiple unsuccessful rounds of in vitro fertilization. The process involves surgically implanting a fertilized egg into the uterus. In the United States, the American Society for Reproductive Medicine reports the median cost of just a single cycle is close to $20,000. The Pleasants say they've paid more than $150,000 out of pocket.
We've had to deplete savings, we've had to borrow, we've had family donations.
They're not alone in their journey.
Everybody's like, oh, just relax, or it'll come when it's supposed to, or things of that nature. And 4.5 years later, it didn't.
Walisha and Chris Georgie say they never realized growing their family would be so difficult.
Nobody's like, oh, I need IVF. Like, that's something that I need to go through and that I need to save for.
Their insurance helped with cost, but after 3 attempts at artificial insemination and a cycle of IVF, none produced a viable pregnancy.
We've had failures, and they were hard.
The couple from Burlington, Vermont, decided to give IVF one more chance, and this time they got the miracle they'd been waiting for.
It's amazing that we're, as a society, that we're able to do this.
Worldwide, since 1978, more than 9 million babies have been born using assisted reproductive technologies like IVF. But treatments are extensive and success rates can vary due to factors like age and health. In a 2019 national report, the Society for Assisted Reproductive Technology found that 55% of women under 35 had a live birth after one IVF cycle. For women over 42, that number is just 4%.
Infertility is a medical disease.
Dr. Jennifer Brown of Northeastern Reproductive Medicine in Vermont says multiple treatments can help, but the long and uncertain road can take its toll.
It's not an optional thing that these individuals want to going through treatment to conceive. This is to build their families. And psychologically, a diagnosis of infertility is so significant in the way it affects the vision of your life that it's equivalent psychological stress to having a diagnosis of cancer in some studies. What we need to do is help them and have less barriers to treatment.
Barriers like cost, which can put life-changing assistance like IVF out of reach. Fertility services are not covered under many insurance plans, and according to a recent Lending Tree survey of more than 2,000 people, 12% said they've wanted help but couldn't afford it.
Solutions for the prevention, diagnosis, and treatment of infertility remain underfunded and inaccessible to many due to high costs and limited availability. WHO is calling for universal access to affordable, high-quality fertility care.
At least 21 states have passed fertility insurance coverage laws, 14 including IVF, according to Resolve, the National Infertility Association. But most plans that are provided by small employers or self-funded are exempt.
To leave us with this cost, to not have anyone to assist us in this, is just not right.
In Louisiana, where IVF coverage isn't required, the Pleasants have been working with Representative Paula Davis to change that.
To hear these stories and the struggles, it really just, it tears your heart apart.
Davis introduced legislation in 2022 that was deferred based on cost, but she says she will continue to fight.
It has touched my heart in such a way that I am just so happy to hopefully be the champion for this.
Back in Vermont, where lawmakers are also working on mandate coverage for treatments like IVF, Walisha Georgie says she knows how lucky she is to be a success story.
It's okay to be fearful. It's okay to feel your emotions. It's okay to not know if this is going to work.
Sharing powerful words of hope for families like the Pleasants.
Rainbows do come even after the thunderstorms, after the tornadoes, after the hurricanes. They do come.
Who continue to push despite all obstacles.
Because I'm fighting to bring my children into this world. And there's no price that you can put on that.
For additional resources on infertility, visit the National Infertility Association's website at resolve.org.